No, I think everyone's here.
Okay.
And we're live.
Yeah, I just have to wait for my screen to refresh. Okay, welcome to Canadians for Long-Term Care's third town hall for national standards in long-term care. Today we have a special announcement that coincides with our guest speakers today. We're pleased to announce our collaboration with Friends of Medicare, BC, Manitoba, Ontario, Newfoundland, PEI, and Canadian Health Coalitions for our National Day of Action on April 27th this year. Together, we will be holding a virtual and in-person Where Allowed demonstration to encourage our federal, provincial, and territorial governments to work together for the urgent need of national standards for long-term care. We invite every Canadian to participate. You can watch the Coalition's social media pages and our own for more information as the date draws near. Today, I'm pleased to announce our guests from the BC Health Coalition, Marcy Cohen, from Friends of Medicare, Sandra Azakar, from the Manitoba Health Coalition, Brianne Gertzen, and from the Ontario Health Coalition, Natalie Mara. First, I'd like to introduce myself and my fellow Canadians for long-term care, from the Canadians for Long-Term Care co-founders. My name is Kathy Parks, and I am an family advocate. I guess a lot of people might know my story already. I'll stop sharing this. I had my father in a long-term care home in Ontario. He actually had a in-home care at first, then a retirement home, and then he was in a long-term care home for 5 months and passed away April 15th, 2022. So without further ado, I'd like to introduce Melissa Miller.
Hi, everyone. Thanks, Kathy. Yeah, so I'm an elder law and nursing home negligence litigator. I have been doing this for several years and have noticed the deficiencies in our system long before COVID. And thankfully, I've managed to group together some of my clients, Kathy and Vivian and Marie Tripp, to form this little group, and very happy to have all of the health coalitions here with us today. So it's going to be a good chat. Thanks.
And Dr. Vivian Stamatopoulos.
Hey, everyone. It's Dr. Vivian Stamatopoulos here. I am a long-term care researcher and advocate, and I have teamed up with Kathy and Melissa to really push forward the dialogue on national standards. So that's why we're holding these town halls, and I hope you get a lot out of them.
Okay, thanks guys. And now we just want to introduce or ask our guest speakers to take a few minutes to just sort of tell us about long-term care in your province and whatever it is that you'd like to say. So we'll start first with Marcy Cohen from BC Health Coalition.
Hi there. So it's really wonderful to be here, and thank you to Canadians for Long-Term Care for organizing this, for organizing the public. It's what we need, and really appreciate your leadership on this. And it is an absolute pleasure to be here. I'm in the fortunate position of coming from a province that's done relatively well. And so I'm going to talk about some of the things that we've done well. Certainly not perfect, but I think some stuff to learn from and to think about in terms of what we want in terms of national standards. And I'm going to do that by talking about using it. You can't do that, I think, without understanding some of what happened pre-pandemic, about why the sector has been stronger and what our advantage is. And I'm going to do that by looking at a comparison between Ontario and BC that was published in September, looking at those differences. And I think that really illustrates the BC advantage very well. So first, in terms of the coordination that was possible, because we have health authorities, the long-term care hospitals and public health are under the same jurisdiction. That made coordination and quick movement much easier, not so in Ontario. Secondly, there's actually more funding, slightly more funding for long-term care in BC, about 10% more. Third, we have significantly more direct care hours. And this is pretty important. So we have 3.25 hours per care per day per resident compared to 2.7. That's just more than half an hour a day. For each resident each day of the year. And nobody in BC is going to tell you that's enough. There's still not enough time to care. There's still not enough time to build relationships, but it is moving in the right direction. Fourthly, there's a smaller proportion of for-profits in BC. So we have 34% compared to 58% in Ontario. And lastly, there's a dramatic difference in terms of the number of shared beds. So in shared rooms. So in BC, 24%, in Ontario, 63%. And I think that speaks everything to the neglect and the aging infrastructure in Ontario. I mean, to understand, as I said this, I think it's really helpful to look at some of the history and some of the ways that that history has benefited us. So one of them is the fact that in BC, we have a strong union movement and led by the Hospital Employees Union in the 80s and the 90s to level up wages and benefits across the sector so that there was one provincial agreement, one wage rate, same benefits no matter where you worked. Long-term care, nonprofit, for-profit, public. We nearly achieved that near the end of the 90s. Does a lot to create a stable workforce, and stable workforce is really important for quality. That was undermined in the 2000s by a new government that basically changed the rules and meant that facilities could opt out and pay lower wages and benefits. Really problematic for the sector. But when the pandemic hit and when again we had a more progressive government, we have reinstated a leveling of wage up. So no matter where someone is working now during the pandemic, everyone's getting the same wages and benefits. That creates stability. It's temporary, but it would never have happened without that precedent. And there is a potential for making it permanent. The other historical fact that I want to talk about is an investigation, a comprehensive investigation that was 2 years long. It went from 2008 to 2010 by the BC Ombudsperson, really addressing the multiple problems and gaps in seniors care. So both home support, assisted living, and long-term care. And that investigation had hundreds of meetings with individuals and groups across the province. And when the report was published, the BC Health Coalition did really a lot to amplify the findings and the more than 100 recommendations. And it created the opportunity for the BC Health Coalition to go to government and advocate for the creation of a seniors advocate position that would represent and address systemic issues. And because of the pressure the government was under at that time, and it was not a progressive government, we actually won that demand. And that has made a big difference. So just give you one example. The increase in staffing to 3.36 hours a day was led by the seniors advocate, convinced the government, resulted in $240 million of funding over 4 years. Following that up, she did an investigation. As it turned out, the not-for-profit and public sector met that requirement, put all the money into staffing. In some senses, in many cases, had more staffing than 3.36 hours, but not in the for-profits. They did not use the money for staffing. And so it speaks to the problems of quality when you have for-profit delivery. And it speaks to the need at the very, very minimum to have much more stringent control over any money that's provided to for-profit facilities. And lastly, during the pandemic, the seniors advocate played a fierce role as an advocate for families of residents and friends of residents in long-term care. So all really speaks to some of the things that we had in place beforehand. I'm just going to turn quickly, I know I only have a couple of minutes, to talk about what some other things that have happened during the pandemic that have made a difference. The first is the fact that the BC government, to their credit, has let the provincial medical health officer really take the lead. So Bonnie Henry and her mantra, be kind, be calm, be safe. So her more measured approach, her more using evidence-based when she makes decisions, her ability to build trust and to appeal to the better side of human nature has really been exemplary and really stands in stark contrast to the premiers in other provinces in terms of how they've approached this issue. And I think that's a really important point. The other thing that I want to mention is that we have implemented the single site order so that there is now, combined with the top up in wages, we've got more stability in the sector. People are working in only one site. They can't transmit across, be infection carriers across sites. And lastly, what I want to mention is what has been a big challenge even before the pandemic and has exacerbated during the pandemic, and I'm sure is true in other provinces, is the problem of retention and recruitment of staff. And again, here BC has been pretty innovative. It hasn't been quick and it hasn't been an easy fix, but they have, in response to this, negotiated an agreement with the union to set up an on-the-job training program providing $22 training wage for people to use in a combination of on-the-job learning and classroom learning to get the equivalent of the 8th month certificate that's now required for a care aide, a personal support worker in Ontario. So they'll get the equivalent training. It's been slow going, and I know in other provinces they've taken a lot of shortcuts in terms of the kind of training they provided. So again, it's an example of what the benefits are if you have a strong union that is really supporting families and seniors as well as the workers. And I'm just going to leave my comments at that. Thank you.
Thank you, Marcy. It's very interesting to hear, as a Canadian living in Ontario, how different it is in BC. Thank you so much. And next, I want to introduce Sandra Azakar from Friends of Medicare.
Thank you. I'm very happy to be here today. Thank you to Canadians for Long-Term Care for putting this together and for allowing us to be here. Friends of Medicare is an advocacy organization that has since 1979 been promoting the protection and expansion of our public health care in this province and in Canada. And I think it's only fitting to mention the heroic efforts that have been made by healthcare workers at every level and the true selflessness and self-sacrifice that have been demonstrated by so many during this year. It is when systems are under stress that when we see the cracks, and the crisis that COVID-19 has presented has cast an unflinching light on the long-standing problems with our continuing care system in this province. The sizable cracks that have been created through decades of privatization and the inequity that perpetual cost cutting has wrought. Seniors in continuing care facilities have for the past year consistently counted for over 60% of all COVID deaths in Alberta. As of March 15, 2021, 1,230 out of the 1,949 COVID-19 related deaths have been of seniors living in residential facilities. Our continuing care system is a patchwork of public, not-for-profit, and for-profit delivery, both for long-term care and home care. Over decades, the public option for long-term care has been eroded in favor of the more lucrative and under-regulated designated supported living, assisted living, and designated assisted living models, basically to defend the failure of support to support and expand long-term care facilities in this province. This model has only served to promote privatization, where in addition to room and board, residents are also charged for medications, nursing, and personal care they require. It has only served to worsen inequality in access to service and has failed to meet the care needs of Albertans while costing residents and their families more. It has been a race to the bottom when it comes to providing care for our loved ones. Shortages of staffing, reliance on family members to fill the care gaps, reliance on the ability of families to help with the cost when seniors can't afford their care needs, all came to a head during COVID-19. On Tuesday, March the 17th, Premier Kenney declared a state of health emergency. Initially, we saw daily updates from the Chief Medical Health Officer on where the deaths of seniors had actually taken place. These updates were eventually replaced by just numbers and are now not specifically mentioned, and one must look at the actual press releases to find out the number of seniors that have died in our continuing care system. Outbreak locations are available if you do a deep dive in the Alberta Health Services website, and or sometimes providers themselves let the residents and their families know. Media reports, for example, help to fill the gaps of information for all of us. So we know that the data is there. It's just not in plain sight for people to see. As the pandemic's impact on seniors grew, so did the casualties. Alberta Health Services stepped into places where the death toll was serious and provided support in terms of staff and in managing the situation. In places like Millrise, for instance, a facility that a few years back became the property of a Chinese-based Anbang Insurance Group, after a bid estimated to be worth over $1 billion. In this deal, Anbang took over BC-based Retirement Concepts. Retirement Concept owned 2 supported living facilities in Calgary, Millrise and Monterey Place. And rather than following the example of other jurisdictions like Spain or Italy, Alberta Health Services opted to appoint Age Care, which is another private company that has received millions of public tax dollars to build facilities, and which in turn has profited massively at the expense of Alberta seniors and their families. Then we saw, a continuation of orders in council were passed early on in the pandemic with regards to workers only choosing one site to work in, so as to deal with the cross-contamination. Those orders had a variety of exemptions as staffing shortage became more of an issue, and out of necessity, sometimes financial, and sometimes because there wasn't enough staff, workers were eventually allowed to work in more than one site. Further orders allowed facility operators to have control over how they would roll out their pandemic plans and address care needs, causing a variety of responses in different facilities. The most recent example of what I've been trying to kind of portray is Churchill Manor at Edmonton, which is owned by a company named Atria. And it is one of those facilities which is private market residential care facilities. And because this is a private market residential care facility, it has no supported living accommodations or continuing care health services standards to meet. So it's the Wild West when it comes to those facilities. We have seen over 9 people die as a result of the facility operators just deciding to open up the common dining room a couple of days before vaccination began to be given to this population. So Alberta Health Services is now involved to ensure residents and staff are protected, but unfortunately, I can't basically report the same thing that Marcy was talking about. COVID has definitely shone a light on the in our ability to the lack of ability that we have seen in this province for decades to care for our loved ones. So I'm just going to leave it there as well. Thank you.
Thank you, Sandra. Disturbing to hear some of that, and some of it's familiar as well. I just want now to introduce Brianne Gertson from the Manitoba Health Coalition.
Thank you, and thank you for having me, Canadians for Long-Term Care. It's been an absolute pleasure getting to know each and every one of you and working alongside you. I do want to recognize that I am speaking from Treaty 1 territory, which is the homeland of the Métis Nation and the traditional territory of the Anishinaabe, Cree, Oji-Cree, Dakota, and Dene people. At this time and at all times, we have a collective responsibility toward reconciliation, particularly thinking about healthcare and health equity. So MHC is one of the newest coalitions to join. We were established in 2018, and we seek to preserve and expand universal public health care with a social determinants of health lens, as well as a clear mandate to ensure that we fight back against any efforts of privatization within our healthcare system. It's really important to understand Manitoba pre-pandemic, as our government, our progressive conservative government, when they took power, ensued on healthcare overhaul, which left our healthcare system cut to the bone. We had vacancy rates at over 20% at some of our healthcare facilities. We had hospitals, emergency rooms closing, and we had a number of capital projects as well as operating funds frozen for our healthcare facilities, all of which set a troubling stage for what ensued when COVID-19 hit. Part of the work of MHC includes our focus on older adults, in particular our Fix Seniors Care Now campaign, which includes the call for a Manitoba Seniors Advocate, similar in the vein of BC, yet independent from the Legislative Assembly, which we believe is of utmost importance in our political climate right now, as well as a clear effort to ensure that our frontline healthcare workers have the wages necessary, as well as the working conditions, because as we all know on this call, working conditions are care conditions, as well as calling for a national standard in long-term care. So what's interesting is during the first wave, as Ontario and Quebec long care facilities were being ravaged by COVID-19, Manitoba was actually enjoying a relatively non-existent first wave. We really lucked out, and I say that with luck because it really did hit our borders last compared to other provinces. But you would think that would prompt our government to do a little pre-planning in anticipation of what experts were calling was going to be a harsh second wave. Instead, they played fast and loose with the restrictions, lifting them with warp speed, as well as on their asinine quest to be the first in the country to reopen. In fact, they launched a public billboard campaign celebrating their successes, which ironically coincided with the steady uptick in cases. The long-term care system has long been broken and has left Manitobans with a patchwork of seniors care, placing an already vulnerable population in the path of destruction that is COVID-19. Like I said, with operational funding frozen, lower staff wages through a concerted attack on collective bargaining and union power, and a consistent reluctance to acknowledge the low staffing ratios and listen to the concerns of not just frontline healthcare workers, but residents and residents' families. I'll talk more about that particular aspect as we go through this presentation, but you add all of this together and the denial that ensued following the calmer first wave led to this lack of preparation. It led to desperate calls from frontline healthcare workers, including PPE. We did not have access to PPE, no matter how many times you hear our premier speak otherwise. We were facing a challenge within our long-term care facilities before we were hitting the second wave. And there was a constant drumbeat amongst our organization and our allies and advocates to ensure that there was proper staffing in PCHs, which is personal care homes or long-term care facilities for folks who are not from Manitoba on this call. And they were ignored by our government. Our government does not place any kind of value on the voices of residents within long-term care or their families or the frontline healthcare heroes who are holding it down during this pandemic. And it really speaks to the lack of dignified care that our government sees that older adults should receive within our province. And one of the biggest issues that we have outside of them actually acknowledging that there was a problem within our personal care homes was the fact that they're not actually using funding to ensure that our healthcare system is stronger and that older adults have the services and resources they need. The second wave hit us, and it hit us so hard in fact, that Manitoba was the second highest province with the deadliest COVID death rate, with 66 of every 100,000 Manitobans losing their life to the virus, which roughly half of those deaths came from the personal care homes. And we will speak a little bit later about the personal care homes that I'm sure all of you have heard from in national news, run by Rivera, which I'm sure Natalie will be speaking to as well in her presentation. Thank you.
Thank you, Brianne. Okay, and next we have Natalie Mara from the Ontario Health Coalition.
Thank you, and thanks to my colleagues from across the country. It's lovely to see you and for everyone who's joined, and a special thank you to the Canadians for Long-Term Care. You have been amazing, and it is an absolute honor to work with all of you. Actually, Dr. Vivian and I, when we did our recent op-ed in the Toronto Star about for-profit long-term care, we talked about what has happened in the pandemic, the first and the second waves so far, as the worst mass casualty event in our collective long-term care history. That is no overstatement. What's happened here has been a river of suffering and grief that has cut its way through the province. And I think I'm weepy, sorry, and has changed, I think, all of us profoundly. I just want to show you what it looks like. So any promise, so I'm just going to share my screen here. Any promise that there was going to be, can you see that? Okay. It's not actually running it as, oh, there we go. Any promise that there was an iron ring cast around long-term care homes in the summer, all of the collective clutching of pearls and the crocodile tears were really false promises. The blue line here shows you just in mathematical terms what the first wave looked like in Ontario's long-term care homes. The red line shows you to date what the second wave has looked like in Ontario's long-term care homes. At this point, in wave one, 1,924 residents and staff died. In wave two, 2,062 residents and staff died to the beginning of March, and more have died since. Those are just numbers, but they are thousands of actual human beings, almost 4,000 now human beings that died in long-term care homes, many with no family until the very end, if then at all, many with woefully inadequate care levels that had crumbled in the pandemic, which were never adequate, nowhere near adequate to start, and which have only worsened. Marcy referred to Ontario as having 2.7 hours of care per resident per day, far below where BC is at. In fact, we've lost considerable amount of that during the pandemic. We lost about a third of the staff in the first wave. We've lost more staff, uncounted numbers at this point, in the second wave. We're in a kind of staffing crisis that there's almost no words for. It's beyond a crisis. It's beyond an emergency. People are left in homes without proper feeding or queuing to eat, with unopened food containers in front of them. I can't tell you how many families we hear from when they go in, if they're allowed, once they get in, they'll see their loved one, their tongues are dry, they're dehydrated, severely dehydrated, they're malnourished. People send us pictures of their loved ones that have lost 30 pounds, 20 pounds, 40 pounds during the pandemic. People who've given up because they've been left alone in rooms, sometimes without even a television. Sometimes there's a TV, but the person isn't angled so they could even see the TV. People who are not turned and have developed bed sores, which are excruciatingly painful and which can kill them. People who have gone without baths. I mean, in the last month alone, I must have heard from more than half a dozen families whose loved ones in long-term care homes have gone without a bath for 6 weeks or more. Some of them up to 12 weeks, in January. The conditions are what you would be put in jail if those were the conditions in which you treated your pets. But this is happening, and it's not a few homes. Through the pandemic, it has been hundreds of long-term care homes in Ontario in which the conditions have deteriorated to the kinds of levels that I'm describing to you. So what happened? Well, we went into the pandemic with far too few staff. In long-term care, I think it's clear to everyone, but just to say it, there is no care without staff. There is no care without staff. You cannot run a long-term care home and provide a safe and secure environment, provide for the physical, the cultural, the psychological, the spiritual needs of the residents, as is the fundamental principle of Ontario's long-term care homes, without having enough staff to do it. We have not had enough staff for years. We've been in a staffing crisis since at least 2017, and that's RNs and PSWs, and other types of staff as well. And that worsened dramatically, as I described, through the pandemic. We also in Ontario have the most deeply privatized for-profit long-term care sector in the country, and the influence of the for-profits on long-term care homes can't be understated. We have fought a pitched battle for decades now to win annual unannounced inspections. We win them, they get taken away secretly. We have to win them again. First, we have to find out that they're taken away, then we have to win them again. And just so people watching know, annual unannounced inspections, the comprehensive inspections, have not been reinstated in Ontario, even after this year of horror in Ontario's long-term care homes. They still are not reinstated. Such is the power of the long-term care industry. We have huge wait lists for long-term care. There are more than 38,000 people on the wait lists for long-term care in Ontario. And I was just looking through them yesterday night. And the lists go up to 3 to 5 years for the public and nonprofit homes. And the longest wait list that I found was more than 8 years. The influence of the for-profits has meant that there's very little accountability. Even when there were inspections and compliance orders, they're not backed by any real consequences for the operators. Operators don't get fined. They don't lose their licenses, except for very, very rarely. And in the pandemic, the first thing that the long-term care homes did was advocate for the deregulation of the only staffing standards that exist in Ontario. So there's a requirement in the legislation, which we fought for and won, along with the nurses in 2007, which requires every home to have one RN on shift 24/7. That's a 40-bed home or a 400-bed home. So it was woefully inadequate to start with. At the beginning of the pandemic, under the emergency orders, the government removed that requirement and allowed homes to run with no RN at all. In the act, again, we fought for this. There's a requirement that PSWs had to be trained PSWs. Again, under the emergency orders, that was deregulated. Homes were allowed to bring in completely untrained staff. Imagine this, when people in a pandemic, when the risk was that thousands of residents would get sick and require more care, what happened was they didn't staff up. They have never staffed up. In fact, they deregulated the only existing staffing requirements under the emergency orders inexplicably. At the same time, I have to say that long-term care is situated in a care continuum, and we can't forget that. Vital home and community services, home and community care in Ontario has also been woefully inadequate, although that sector has grown dramatically over the last 20 years and has been one of the few sectors that has actually gotten increases in funding above the rate of inflation. But it's never kept pace with the offloading of the more complex hospital patients and the long-term care, the people waiting to get into long-term care who can't get in. And so home and community care is insufficient and has really severe staffing shortages, worse actually than long-term care, but there's almost no data available on home care. At the other end of the spectrum, Ontario has cut more hospital beds than any other province in Canada. BC is second last, but we're way at the bottom of the country, and we're at the bottom of the developed world. And we've moved people out in Canada as a whole, out of hospitals that they haven't more radically than they've done in any other OECD nation, and definitely more radically in Ontario than anywhere in the country, without regard to their right to consent and without regard for whether where we move them to can provide safe or adequate care. And so what happened at the beginning of the pandemic was that 2,200 elderly hospital patients that were deemed ALC were moved out to long-term care homes, retirement homes, and hotels and other facilities, or home without adequate care. People were moved into long-term care homes in outbreak. In fact, this weekend, I just spoke with a man whose mom was moved out of a hospital into a long-term care home in outbreak. And he asked, is my mom going to be safe? They didn't know the home was in outbreak. Nobody informed them of that. She lasted 3 weeks. She was of sound mind when she was moved in. She became delirious. Her roommate caught COVID and died. She was left alone in her room. She had no access to her family. When she died 3 weeks later, at the funeral, her son describes not being able to recognize his mother. He said she was so emaciated. He described her as looking like a person that had survived a concentration camp. This is what has happened in long-term care in Ontario, and it's not over. The pandemic will end, thank God, soon, I hope. We are into a third wave now. But the pandemic will end, the vaccines will roll out. But the fact is that the levels of care and long-term care in Ontario are worse than they were prior to the pandemic. The human rights abuses, the violations of people's right to consent, the refusal to provide access to hospital care for long-term care residents. Last fact, during the pandemic, long-term care residents in Ontario were not hospitalized. They weren't even given the option, even when their long-term care home could not provide the care for them, when they couldn't feed them. In Ottawa, I'll never forget a woman describing the conditions in which she found her mom. She wasn't allowed in to help feed her or provide care for her, but she was allowed in at the very end of her life as she was dying of COVID, went into her room. There were feces all over the bed. Her mom had been left in feces for so long that it had dried. It was smeared on the wall. There were drink containers in front of her, but unopened because there had been no one there to help her feed. They couldn't see any staff around. Her tongue was dry. She was severely malnourished and dehydrated. Residents were wandering into and out of her room, even though she had COVID, potentially catching the virus themselves. The staffing had crumbled and the care levels had crumbled. This has not ended in Ontario's long-term care. In fact, nothing has happened substantively to improve the care levels. It is the worst that I've seen in my life, and I hope I've made it clear enough that we cannot go on like this. We have to achieve change. It hasn't happened, and we can no longer let people live behind the walls of long-term care with their suffering falling on deaf ears. Thank you.
Thanks so much, Natalie. It's really chilling to hear all of you talk about what's been going on in your provinces. And, you know, I think, you know, looking at the numbers from Ontario that you just showed us is awful. But what we haven't seen data on and what we haven't measured yet is how many people have died, not from COVID, but during COVID because of the poor care provided. I spoke to a woman, it's super quick because I know we're running short on time, spoke to a woman super quick yesterday whose mom was a Holocaust survivor. And she said, Melissa, my mom survived starvation and dehydration and torture in the concentration camps only to immigrate to Canada and die of dehydration and malnutrition in a long-term care home in Canada. That is where we're at. That is the dire situation we are in, and it is disgusting. I want to move on to, we have a couple questions for you guys, but you guys actually covered most of the information that we were going to ask you before we get to the group questions, because obviously we want to talk about national standards. But Marcy, for you, I wanted to ask, you've told us what went right in BC. And you mentioned to us that there were steps taken during COVID by your government, which is incredible. But my question is, what else can be improved in BC in long-term care? You're muted. There you go.
Yeah, I'm really humbled by hearing all your stories and from across the province, other provinces. So I want to say that there were times when BC system was overwhelmed as well in the second wave, where the coordination that had been in place didn't work, where there was the kind of tragedy that you're describing. Fortunately, it wasn't as massive and as it was there. But I will say some things. Definitely, there isn't enough recognition of infection control and infection control expertise and training and support in the facilities for any of the staff. That needs to be a permanent shift and a change. The staffing, you know, what I would say around what needs to change is the whole decision making is so top down that those relationships that are most important, like the relationship between the frontline caregivers, the senior, their family, are marginalized when it comes to decision making, even though they provide most of the care. And, you know, that was really evident during the pandemic when you could see the exclusion of family and residents. And we need to turn that around. We need to really put at the very center of care those relationships, because that's what delivers quality. That's what makes a sense. And it means so much, because if you have those relationships, you have to have good wages. You have to have good working conditions. There's lots of implications for standards. So I really think that that's a really important lesson that we need to take is the philosophy, the way in which frontline staff are supported by the managers and by the professional staff has to shift. They have to be at the center, and those other people need to be in supportive roles. And of course, there needs to be way more staff, way more support for training, and a way more. I really agree with Natalie about the importance of integrating the home support side of things as well, because we hear continually problems there. We have, I don't think we've increased home support probably as much as Ontario, but we have lots and lots of problems there and lots of gaps. And I think we will do better when we're talking about long-term care standards if we put it in the broader context of seniors care more generally, because it's something that more people will care about and more people will join us in terms of what we're doing. So those are some other things I want to add. I also want to say we have our recruitment and retention issues are very, very serious. Never been this bad. So even though we've got that good training program, we're having a very hard time attracting people to want to work in the sector because people are scared. People are worried about it. And so it's pretty desperate in terms of that. So definitely not at the same level as other provinces, but no way is it an adequate system. No way is there not gaps. No way is it true that if you're lower income and you can't bring in other care provider because you can afford to do that and other support, that you get less care than those people who have some money and can bring in their own private care providers. That two-tier also has existed in BC system for a very long time.
Thanks, Marcy. Oh, I think I'm going to jump in now. I want to ask Sandra a question now, because your premier has said some controversial things that kind of remind me of our premier's response to long-term care. So I was wondering if you could tell me a little bit about how you have felt about, Premier Kenney's performance of handling long-term care in your province.
Well, yeah, that's a really great question. We, like I said before, as of March the 15th, we've had 1,230 people die in our continuing care system. And those are real people with families, with friends, with loved ones behind them. Our premier likes to throw out stats, and he likes to compare us with other provinces to point out that we're doing so much better than across the country, specifically in Ontario and in Quebec. But he also points out that that most of the people who have died of COVID-19 have already outlived Alberta's average life expectancy. And to me, he just devalues the life of seniors by making statements like that at the legislature. His exact quote was the average age of death from COVID in Alberta is 83, and I'll remind the House that the average life expectancy in the province is 82. That gives you the political context of where we're living. We know that this government has no plans at all to move away from the continuation of the privatization and commodification of our seniors' care. During this pandemic, we've already spent over $268 million in public funding that were given to for-profit and not-for-profit to cover losses of revenue and accommodation charges, to top up some of the wages, some of which haven't been received by workers as of yet, to provide PPE and to fast track workers so that we could fill the gaps that were created during this pandemic. But anything that comes from them basically gives us that direction. Any announcement that has been made is that they will continue to basically put out our seniors as a commodity, and we have no hope. I wish we had hope that we will see a shift in the way that this government provides care to our seniors. There's currently a continuing care legislation review that will put 12 pieces of legislation and regulations together. And we're hoping to see some of the issues that were brought to light during this pandemic being addressed in that legislation. Marcy talked about the amount of direct care. In Alberta, we only have a minimum of 1.9. And so when I talk about race to the bottom, that's what I'm talking about, that if we don't see significant changes, what we will do is continue to see seniors not getting the level of care that they need.
Thanks, Sandra. I just, I think across the country, we need to stop marginalizing our long-term care residents. It's really upsetting to hear. I just want to quickly ask, and we want to keep this brief as well, Brianne, I was reading up a little bit about 17 recommendations that came out in Manitoba last week. Can you speak to that and how you feel about them?
Yeah, they actually came out in the beginning of the month of February, and it was recommendations specifically looking at the Maples personal care home. So Maples is a Rivera privately owned for-profit run long-term care facility here in the province that experienced a massive outbreak. And when I say a massive outbreak, we had calls from frontline workers, residents, their families talking about there's concerns within our home, Maples and Parkview Place, both at the same time, Even in our legislative assembly, our former health minister now said that it was overblown. Don't worry, we're holding virtual meetings with Rivera's. Everything is fine, right? And you guys are blowing it out of proportion. So it took actually a viral Reddit post from a paramedic who was called on the night in November where 6 ambulances were called to Maples for attention. And in the Reddit post, he described it as something out of a nightmare. And so what's interesting about this is this review took place. There's 17 recommendations. It was supposed to be an independent review from somebody who lives in BC. So they know Manitoba quite well and the realities that we're facing here in the province. However, the recommendations are largely contained to in outbreak situations, and the recommendations that do refer to the system as a whole are lackluster, to put it frankly. I think what also it leaves the room for is for the government to review staffing and review funding, therefore no actionable items there. So it's really easy for the government to say, hey, look, we did this review. We're going to implement these recommendations. Are they going to implement the recommendations? I would say the track record of our government and the transparency and accountability we've seen to date is not there. And I would implore all older adults in Manitoba to follow the MHC and our allies and advocates and the Canadians for Long-Term Care to make sure that this government knows that accountability matters, that holding Rivera to account matters, and empty platitudes will not suffice. I've had too many calls from residents' families who are heartbroken and gutted about what's taken place, and the silence that has come from our government is unbelievable. It's deplorable. And when they try to sell a different bill of goods, I want folks to know that our premier, Pallister, and the progressive government, conservative government in Manitoba turned their back to older adults when they were in crisis. And they are now embarking on a revisionist history about what's happening in long-term care. I am done. And I think a number of us who have been listening to these calls and doing this work are fed up with the empty platitudes. We're looking for action. We're not looking for finger pointing. We need the funding, and we need it now.
Thanks, Brianne. That was
Yeah.
great.
Now, well, on that note, so Natalie, my question to you is very related because you've been very vocal about Ford and Fullerton. And I want to just insert here, I've said this on the other town halls, and I think it's important to keep repeating, Canadians for Long-Term Care, we are apolitical. These are issues that surpass party politics, and the same is true for all the health coalitions involved. But Natalie, you've been very outspoken against Ford and Fullerton. I want us to go into the discussion for national standards, and so I think it's appropriate for you to lead that discussion, telling us why it's not enough for us to be able to rely on the provinces alone to fix this problem, despite the fact that long-term care is within provincial jurisdiction.
Mm-hmm. Well, I mean, in Ontario, there are between 20 and 25 long-term care homes in which virtually every single resident was infected and virtually all of the staff. This is in the second wave. The infection control that Marcy talked about didn't happen. PPE was locked up, staff couldn't get it, it was rationed. Costs were cut, staffing was never improved, just all of those things. And at the end of all of this horror that we've all seen, not one home was ever fined, not one. No one has lost their license. There has been no penalty for any home, not the most negligent, the homes that show total disregard for human life, for the vulnerable people whose lives were entrusted to them. Nothing has happened to them. Well, we can't go on like this. I mean, most of this policy does lie at the provincial level, and we have actually a decent Long-Term Care Homes Act, but it's not enforced. It's not enforced, and the homes aren't held accountable to actually the pretty laudable standards, the decent Bill of Rights. There's some things that could be improved, but it's pretty good as it is. The issue is the power of the for-profit industry, and we are going to need help. We're going to need all the help we can get to unseat them. There are thousands, tens of thousands of licenses coming up in Ontario. We have a whole rebuild that's happening. As I said, there are thousands of people waiting for long-term care. We're going to need federal funding to expand long-term care, to provide those services, to restore the continuum of care. There are going to be thousands of people with chronic care health needs coming out of the pandemic. The care of those people is going to need to be provided for. So we're going to need a kind of new deal in healthcare. I think if we were to achieve national standards, I think the fundamental thing that the Canada Health Act has done, even under governments that haven't enforced it, is to set a moral compass for the country that really has held. I mean, we have single tier public Medicare for hospitals and physician care by and large in Canada. Yes, there's been some erosion. Yes, there are private clinics that behave terribly and so on. But by and large, it is deeply held as a value for Canadians. We need to bring long-term care into the mainstream. We need to set a level of expectation about it. Those could be achieved through national standards. And we could require the provincial programs, if they want federal funding, to meet certain criteria around quality, around accountability. They couldn't micromanage from the federal level, but it sure could help. And it could set a kind of moral compass that all Canadians understand. And it's hugely supported across the country. So now we have to mobilize that support, because my fear is they're all going to pay lip service and make it look like they're doing something and actually do nothing at all. And for us in Ontario and in the other provinces that have deeply privatized long-term care systems, we are in the battle of our lives to challenge the power of the for-profit industry. We have a chance now to win it. We have a bigger movement than ever. People have seen what they do. We need to mobilize it, and we have to win this one.
Thanks, Natalie. I just really quickly, I'm gonna switch the view so we can all have open discussion. Everyone can unmute themselves if you'd like. I just wanted to quickly ask Marcy, you know, we sort of have heard throughout this that BC has done a bit better. We know the East Coast has done quite a bit better. So when we talk about national standards, and we've heard some really horrific stories today, we're not talking about lowering anything in any province that currently exists, but rather the provinces that aren't doing as well need to come up. And it needs to be that, as the Prime Minister has said, no matter what province you live in this country, you will be guaranteed a standard of care. So how do you feel about national standards, Marcy, in BC?
Absolutely supportive. Absolutely supportive. Like, things are not good enough in BC. And what I described was trying to show where you guys could, you know, where things are somewhat better. And that's, I think it's always good to have the positive examples, but the situation is not okay. You know, the staffing levels are not okay. The situation for lower income people is not okay. We still have these big corporations providing care in BC that is not proper standards. And I just want to reinforce what Natalie said, because if we're talking about a new deal for healthcare, we do know that the federal government does have spending powers where they can set criteria. And if we do it based on principles that aren't the same as the principles of the Canada Health Act, but are principles appropriate for the long-term care setting, like relational care, like affordable care, you know, like focusing on the determinants of health, really appropriate principles, a lot flows out. So like I said before, if you think of relational care, you have to think about adequate staffing. You have to think about higher staffing levels. You have to think about more permanent staffing. You have to think about proper training. So if we have those principles and we appeal to the Canadian public based on what are the values that we hold, in terms of the way we did with Medicare, and then you can see the concrete standards that come out of that, I think we have a chance. And I just want to mention one piece of the Constitution that is underused. So not the spending powers, but a piece of the Constitution that says that essential public services of reasonable quality is the joint responsibility of both the federal and provincial governments. So let me repeat that. Having essential public services of reasonable quality for all Canadians, like all Canadians, is the joint responsibility of both the federal and provincial government. And so we could have the federal government taking leadership based on the evidence about what that quality looks like. And our principles are based on that. So I think we have I don't want to go into any more detail. I just wanted to raise that because I do think we have really good possibilities of where to go. Thank you
so much. Sandra, can I just ask you the same?
Oh, for
Yeah.
sure. And I'm not going to repeat what Marcy and Natalie so eloquently said, because that's basically where we're coming from as well, right? I just wanted to add that, that markets for us work really well in certain things, but we have rights that come along with citizenship, and, such as education and social services, and certainly healthcare. And these are things that cannot be turned into marketizing opportunities for people to make a profit, because lives are at stake here. We have heard that over and over again. And so I certainly agree 100% that we need to be looking for the well-being of all Canadians across this country. And that's where the federal government has a huge role to play. I think we see in political will to make differences in the way that people receive care. But when you don't have that ability, when governments are refusing to kind of make the necessary changes, then I think we need to be having these conversations across the country as to what it will look like once we come out of this pandemic.
Thank you, Sandra. And of course, Brianne, I'm going to ask the same for you. National standards.
Yeah, they're obviously we're very supportive of everything that was said, but I do want to highlight the fact that my province is definitely one of the holdouts on a number of things related to improving long-term care as well as improving healthcare. And I really do want to impress upon the federal government that accountability with strings attached to funding that comes to our province must be there. Our government has a proclivity to privatize and then pay down deficits. So a far cry from actually improving what that money is earmarked for. So yes, I agree with everything that's been said thus far, and also did want to highlight that fact that our premier won't do this. And if he does receive the money, it's most definitely not going to go to where it needs to be going.
Thank you, Brianne. And sorry, Melissa, I know you're going to say something. I saw you lean forward. It's going to look, every province is different, right? Everyone has different needs. And like I said, some have done better than others, but it's been such a pleasure. I really want to say to not only be working with all of you, but to hear the different stories, to hear the similarities, to realize where, as an Ontarian, we could have done better. We need to learn from each other and work together. And Melissa, I'll let you say what you wanted to say.
I just wanted to say that it's so moving to have you all together and to be working with you guys, because this is, I can't tell you, Natalie referred to the fight of our lives. I've been feeling that all year, and I'm sure you guys have too, right down to even having to fight our provincial government to even be able to bring lawsuits. Natalie talked about stripping away of funding and regulations. Well, instead of holding long-term care homes to account, we've also seen across Canada immunity legislation being put in place, protecting these for-profit homes from any litigation and accountability. It's so disturbing. So it's really incredible to have this unity among all of us from such different backgrounds, and to be able to call upon the federal government to implement this. And I think the message that I've heard consistently in any of our discussions and what I've heard today is we need that moral compass. I think it was Sandra that said that. We need that moral compass. We need to have our federal government shift our attitudes once again and make sure that we're protecting the most vulnerable people. So I'll flip it over to Kathy to close things out, but I just wanted to thank you all and just tell you how much it means to me, even personally, to work with you guys.
Yeah, I think we all feel the same. It's an absolute pleasure. And, it's a topic that's difficult and necessary, and what a collaboration that we've had. It's been an absolute pleasure. I just want everyone to take a minute while I put this up here again for everyone to see. Our National Day of Action, April 27th, we are asking all Canadians to participate. We'll have ways on social media that you can participate. We will be sharing more information about whether it's in person or virtual, depending on what's happening in your province. We don't want to break any pandemic rules, but it's important. It's important that we have this discussion. It's important that we stand up for people in long-term care, for the ones that are there now, for the ones that will be there in the future. It could potentially even be someone in your own family as I learn myself. So it's really, really, really important that we have these conversations, that we don't just say vaccines are enough. They're not enough. We need national standards. So again, thank you, everyone. Really appreciate everyone participating today. It's been great.
Thank you. Thank you. It's